Good morning. I would like to officially call the meeting to order and welcome you to the Shared Health Annual General Meeting. My name is Chad Saxon and I will be your moderator for today's event. We would love to hear where you're listening from, so please make sure to drop us a message in the chat feature, which is part of the GoToWebinar panel. Should be on the right side of your screen. So before we get to the presentation, we'll go over a couple of housekeeping matters. Today's AGM will be recorded and placed online. Attendees will not be able to turn their camera or microphone on during the meeting. If you have any questions during today's annual general meeting, please use the question pane. You will see the question pane again in the right-hand side on the GoToWebinar panel. If you have a question following the AGM, please direct them to info@sharedhealthmb.ca. If we're not able to get to all questions today, all remaining questions will be posted online or responded to directly via email. And with that, I hope everybody enjoys today's presentation, and I will now turn things over to Shared Health's Board Chair, Dr. Brenna Shearer, to begin with the reading of the Statement of Indigenous and Ancestral Territorial Lands.
Thank you, Chad. Health services across Manitoba are provided in facilities located on the original lands of First Nations, Inuit, and on the national homeland of the Red River Métis Nation. Manitoba's health authorities respect that First Nations treaties were made on these territories, acknowledge harms and mistakes, and we dedicate ourselves to collaborate in partnership with First Nations, Inuit, and Métis peoples in the spirit of reconciliation. In addition to the statement, Shared Health believes it is our responsibility together to dedicate intentional efforts in creating a healthcare environment that is accessible, safe, and equitable for everyone. We also recognize that within our provincial scope, multiple ethnicities, cultures, and diverse communities exist, and that we are a designated bilingual organization. Hello, bonjour, and a warm welcome to all who have joined us today for our 4th annual general meeting, where we are so thrilled to share the work of the Shared Health team for the fiscal year April 1st, 2022 to March 31st, 2023. We are also very happy to share that Uzoma Asseguara, the Honorable Minister of Health, Seniors, and Long-Term Care, is with us today to bring greetings. Please join me in welcoming Minister Asseguara to say a few words.
Hi, everyone. Very happy to be here today, and thank you very much for the introduction and for the very important land acknowledgement. I won't take up too much of your time during this AGM, but I appreciate the opportunity to say hello and to not only introduce myself as your recent Minister of Health, Seniors, and Long-Term Care, but also to bring greetings on behalf of our entire government. I know you folks have been working very, very hard to strengthen healthcare in our province, and things are challenging right now, and I know that that's impacting folks in different ways. But certainly over the past several weeks that I've been in this role, I've had the opportunity to meet with leadership. I've had the opportunity to meet with folks across the system who are part of or connected to Shared Health. And I've been very, very inspired and impressed to see the people doing incredible work in our healthcare system and working in ways that I'm very excited to continue to learn about, but also to make sure that we're working collaboratively to address the issues that Manitobans are facing and, to strengthen healthcare overall. Our government's message from the beginning has been that we want to make sure that we're doing our part to not only strengthen healthcare, but to improve the culture in healthcare. And that means that it's so important for us to be a listening government. It's so important for myself to practice the art of listening and to be committed to sharing ideas and receiving feedback. And so in the spirit of that, I want to extend the invitation to you folks to always reach out should you have ideas. If you've got concerns, if you have feedback that you think would be really helpful in terms of how we approach things across our province in healthcare, I'd love to hear from you. So there are many ways you can reach out. We'll be sharing more details on how we plan to be out and about listening to folks. But I certainly do hope that you will reach out via email or phone call. I've met several folks who are part of Shared Health actually out at community events, and I want to thank those folks who have taken a moment to say hello and approach and talk about what it is that they do and to provide me some information. Never hesitate to do that. The last thing that I'll say is that, every single person who is doing the work right now is valued. And, our government has a mandate given to us by the people of Manitoba. And that means that we're taking a new approach to how we do things in healthcare in the province. And, change can be difficult sometimes, but I'm really hopeful that all of us are working, in the same direction, that despite changes that might happen, we all recognize that doing this work together, doing this work in collaboration is really how we're going to forge a path forward that puts people first. So I recognize that I see some people continuing to join this meeting, which is really great. I'm not going to have the opportunity, I think, to get to greet everybody who joins. But again, my door is always open. I'd love to hear from you. And I'm thrilled just to be able to take a couple of minutes to say hello today. Thanks.
Thank you, Minister. We are honored that you are here and for taking this time out of your busy schedule to be with us. The staff of Shared Health, the board, the leadership team, we're committed to working with your government to achieve improvements in healthcare services and delivery. Whether you are with us live or watching the recording, your presence is deeply appreciated. As Chad mentioned, I am Brenna Shearer, board chair, and I'm part of a team of board members who are passionate about serving in healthcare. I wish to express gratitude to my fellow board members, both past and present, for guiding Shared Health in its purpose and unique role within Manitoba's health system. Collaborating with provincial partners and our senior staff, the board strives to make decisions that best serve the communities we are proud to support. To health regions and government partners and collaborators, your presence today is a testament to our partnership. We are grateful for your contributions and collaboration in planning and service delivery. To our incredible employees, clinical providers, and volunteers, the challenges of the past several years have tested your strength and spirit. Whether directly working with patients or in other crucial roles, your perseverance has not gone unnoticed. Your dedication, care, and service to Manitobans is valued and appreciated by our board and the Shared Health Management team. We thank you and appreciate you. We are committed to reshaping the culture that emerged from the pandemic into a vision and work experiences that prioritizes your well-being. Thank you for continuing to be here every day. Now let's preview what lies ahead in today's agenda. You'll hear insights from Lynette Saragusa, our Chief Executive Officer, along with presentations from Charlene Lafreniere, Provincial Lead Indigenous Health, Connie Newman, Provincial Lead Health Workforce, and Dale Gustafson, our Chief Financial Officer. Following the presentations, there will be a question and answer segment to answer any questions you may have. As Chad mentioned, feel free to drop your questions into the question feature at any time. Any follow-up questions can be emailed to info@sharedhealthmb.ca. As we reflect on the reporting period year, we've had the pleasure of hearing about the hard work of our Shared Health team. I think no one in this virtual room will argue that our staff are truly the heart and soul of our organization. In a moment, we'll share a brief video montage capturing the essence of our amazing team in action. The collection of images is more than just a visual display. It's a celebration of the passion and commitment that our staff demonstrate every day. As you watch, I invite you to reflect on the collective effort that goes into supporting our health system. These are the faces behind the scenes, the individuals who work tirelessly to ensure the well-being of those we care about. Roll the video, Chad, and let their images inspire us all.
Thank you, Brenna. Each face, each moment captured represents a story of compassion, commitment, and strength. I want to take a moment to highlight the diverse roles within our organization showcased in the video. From clinical staff working in every imaginable care setting to the support roles without which our system would not function, and the managers who offer support and guidance in the delivery of care each and every day. Every team and each individual plays a crucial part in ensuring our ability to deliver safe, accessible, equitable health services. Also, what we've seen is more than a montage. It's a testament to the spirit of our team. It's about late night shifts and early mornings and the sacrifices made to prioritize the health and comfort of each patient, resident, and client that we care for. I encourage each of you to reflect upon the efforts of these important contributors to Shared Health's achievements as we navigate through the details of our 2022-23 annual report. I started in my role on May 1st, and I am thrilled to be back at Shared Health, reconnecting with the organization and its impactful work. During my brief absence, I witnessed significant changes, new faces, achievements, and challenges that underscore the dynamic nature of Shared Health. Shared Health was created to enhance access, quality, equity, and outcomes for patients and improve work life by connecting teams together across the province, standardizing best practices, and streamlining processes in order to deliver better healthcare outcomes for Manitobans. Shared Health is legislated to develop the clinical and preventive service plan for Manitobans. And we began this work back in 2019 when we conducted analysis of patient data, chronic disease incidents, social determinants of health, and outcomes at various levels. Our approach involved assembling hundreds of provincial clinical providers and conducting jurisdictional scans. We identified national trends in best practice, recognizing where we excelled and areas that needed improvement, and began to formulate improvement recommendations. The energy at the table was profound, bringing together clinicians, leaders, administrators, community representatives, and the public. And in many cases, this was the first time that they came together to discuss the needs of the population and to plan health services provincially. As I look back now at where we've been, I appreciate how much all of us have been through since those early days. In the past several years, we have learned many important lessons about how to find strength through adversity, the value of innovation, and the importance of wellness and safety. Most importantly, we have learned about the power of working together in partnership to promote health and prevent illness, especially those who have been disadvantaged or experience inequities. And so we emerge from this especially challenging time in our history. I am cognizant of the work that lies ahead of us, but I'm also hopeful about the possibilities and very motivated to work together towards a better future for all of us. So thank you very much for welcoming me back to Shared Health. And I do look forward to moving ahead with the same spirit of collaboration, compassion, and grit that has defined our journey so far. We are Shared Health. What does this mean? Who are we? Well, we are 18,000 healthcare staff spread across the province in over 80 sites. We either directly support patients or work behind the scenes to support various clinical teams and operations. We go beyond the geographic location of where our clinical teams are based and extend into the planning and implementation of a coordinated provincial approach to health services in partnership with other regional health authorities and Cancer Care Manitoba. Collaboration is at the center of our efforts. We work hand in hand with health authorities, government partners, and community representatives to lead the delivery of specific health services requiring provincial consistency or specialized expertise. Think of diagnostics, mental health and addictions, and emergency response services, areas where consistency and standards are so necessary to establishing quality care across our province. Behind the scenes, Shared Health provides the vital operational and administrative support that keeps the gears of our healthcare system turning. From supply chain management to clinical engineering to digital health services, our goal is to lighten the load for health authorities, allowing them to concentrate on what matters most, the delivery of quality healthcare services to their populations. So as we share the amazing work of our Shared Health team members, keep in mind the intricate web of coordination and collaboration that underpins the work of Shared Health, all in the service of better healthcare for all Manitobans. You can think of us in 3 easy words: planning, services, and supports. I will now turn over the mic to Brenna.
In 2022, Shared Health established its first permanent board of directors. Previously, Shared Health was led by an interim board structure. Our new board held its first meeting in April 2022 and throughout the year have focused on several critical areas. I would like to thank the interim board members, Karen Hurd, Bernadette Proyne, and Scott Sinclair for their years of service. First and foremost, we have dedicated ourselves to the integration of Indigenous health as a key strategic priority in our 5-year strategic plan, to which the management team is hard at work developing. Lynette will share more on this later in our moving forward portion of this presentation. We are committed to ensuring that Indigenous perspectives, priorities, and truths are woven into the fabric of our organization to support reconciliation. Additionally, we've been diligent in refining our internal processes, such as the development of a CEO reporting template, streamlining the reporting structure, and ensuring transparency and accountability in our leadership. Our pledge to board stewardship extends to the enhancement of our board practices and communication processes. We recognize the importance of clear, effective communication, both within the board and with our stakeholders, which ultimately fosters an informed decision-making environment. Lastly, our board has been actively engaged in committee work. The Finance Committee ensures fiscal responsibility. The Audit Committee safeguards financial integrity. The Quality, Risk, and Performance Management Committee focuses on service excellence and risk management, while the Governance Committee shapes effective board structure and policies. I wish to thank each of our board members, Lori Campbell, Nathan Pito, Karen Taylor-Hughes, Nicole Stefaniak, Doris Young, Gail Carswell, Gord Heriniak, Celia Kaufman, Grant Wachenko, David Oakley, and our Corporate Secretary, Carla Jansen. I also want to thank committee members, the Shared Health leadership team, and the many guests who have joined our meetings for ensuring that we have the appropriate data to guide our decisions and conversations. Also, I would like to thank outgoing board members, Brenda Martinison, Ken Lamoureux, and John Douglas for their contributions to the board. Now, let's shift our focus back to the notable achievements of our staff for the period of 2022-2023. Over to you, Lynette.
Thank you, Brenna. So let's explore the strides of the Shared Health team in our key roles, beginning with services. So at the Health Science Center, our commitment to excellence is not only defined by the critical services we provide, but also by our incredible teams. With close to 8,000 staff and physicians, we stand as the provincial cornerstone for critical care, serving patients from Manitoba, Northwestern Ontario, and Nunavut. From trauma and transplant to burns, neurosciences, complex cancer care, and hospital-based pediatric services, HSC is at the forefront. In the past year, we have seen over 103,000 emergency department visits, performed over 23,000 day surgeries, celebrated over 6,000 births, and facilitated over 30,000 patient discharges. One initiative that I wish to highlight is the Minor Treatment Clinic, which is intended to reduce pressure on the facility's adult emergency department and connect patients who have less urgent care needs with other on-site options. Planning for this initiative began in 2022-23 and recently launched in this fiscal year. I wish to thank Trish Knight, Ray Witt, Johnny Colatruglio, and the project team for their work to establish the Minor Illness Clinic. Stay tuned as we look forward to reporting on the clinic's activities and the positive influence it has had in our community at next year's AGM. Emergency response services, diving into this, which is one of our provincially coordinated service areas. This vital department is the pulse of integrated emergency medical care across Manitoba. Responsible for both direct service delivery and oversight of municipal and contract services province-wide, our emergency response services team plays a pivotal role in ensuring timely and effective emergency medical responses. They provide assessment, treatment, and transport when and where it's needed. The virtual emergency care and transfer service, we call Vectors, brings Shared Health's Medical Transportation Coordination Center in Brandon and the Winnipeg Fire Paramedic Services Communication Center together to provide timely access to air and ground transport resources. Staffed with emergency department physicians, advanced practice respiratory therapists, and advanced care paramedics, this innovative program enhances coordination and provides specialist expertise to providers managing the care of complex patients and transfers. Earlier this year, Manitoba was profoundly affected by the tragic events that took place in Carberry. The coordination and support of many individuals involved with Vectors, Brandon Regional Health Center, Shared Health Emergency Response Services, and other responding agencies, including STARS and specialized teams at HSC, were invaluable on that day and the days that followed. Thank you to Dr. Rob Grierson, our Chief Medical Officer from ERS, and also Helen Clark, who has recently retired from her role as Chief Operating Officer for ERS. Thank you for your years of service and perseverance in bringing this initiative to light. Diagnostic services. Within diagnostic services, our dynamic team of over 3,000 staff operates in over 80 facilities across Manitoba, conducting an astonishing 1.2 million imaging procedures and processing over 7 million lab tests annually. So if you think about it, most people have had access to diagnostic services at least once in their lifetime. And these teams play a crucial role in diagnosing health issues, enabling providers to prescribe the best course of treatment. And consider the impact if we didn't have these dedicated teams. Diagnosing and treating health issues would be a significant challenge. Their work is truly at the foundation of many of our healthcare decisions. During the dynamic landscape of our reporting period, CADM Provincial Lab integrated into Shared Health Diagnostic Services in April 2022 and continued to provide COVID-19 testing for Manitobans. We are thrilled to have welcomed Dr. Paul Van Kessel and his team to Shared Health. Celebrating a significant achievement, Manitoba hospitals have earned the province-wide recognition with the Using Blood Wisely hospital designation status. This accomplishment reflects our commitment to implementing transfusion stewardship practices, optimizing processes, and achieving sustained reductions in inappropriate red blood cell transfusions. Congratulations to Dr. Charles Mazuka, Medical Director of Transfusion Medicine, Darcy Heron, Technical Director of Transfusion Medicine, and Christine Peters in her role with Choosing Wisely Manitoba, supporting her team for this outstanding contribution to patient safety and recognition opportunity for Manitoba. We acknowledge the profound impact that mental health or addiction challenges can have on children, youth, adult, families, and entire communities. With compassion at our core, we operate inpatient, outpatient, and support programs, striving to provide accessible, responsible, and inclusive services. Our statistics we'll share on screen underscore the urgency of ongoing advocacy for additional supports. It's a reminder of the critical need to stand by individuals in their most vulnerable states, fostering a community where mental health and substance use challenges are met with understanding and support. In April 2022, we welcomed into our mental health and addictions family Selkirk Mental Health Centre, Manitoba Adolescent Treatment Centre, programs from Addictions Foundation Manitoba, Clinical Health Psychology, and select WRHA mental health programs. Since then, these entities have been actively integrating into the mental health and addictions portfolio, enhancing our capacity to provide comprehensive and compassionate mental health and addiction services. Some of the numbers we'll share are really only a portion of the wide scope of work underway. In our moments of need, Mental Health and Addiction Treatment and Rehabilitation Unit supports youth and adults. Through our programs, we've reached out to assist over 2,500 youth clients and over 3,000 clients through the Manitoba Opioid Support and Treatment Program. From the Mental Health and Addictions Youth Central Intakes to the Manitoba Addictions Helpline to the Crisis Response Center, each have made a profound impact in helping those who are in immediate mental health crisis. There were close to 4,900 assessments and follow-ups through the Rapid Access to Addiction Medicine, the RAM clinics, 41 communities utilizing our telepsychiatry program, over 24,000 visits to the Crisis Response Center, and the Alternative Response to Citizens in Crisis, our ARC program, engaged in 1,250 events. We would like to take this time to share more about our RAM clinics and we have developed a short video to help explain what a RAM clinic is and how they operate. Chad, if you could please roll the video.
RAM clinics are essentially low barrier drop-in clinics for anybody looking for support with substance use. That can be that people are totally ready to make a drastic change in their substance use and are aiming for abstinence from whatever substance it is they're using going forward, or it can mean that they're interested in engaging in some harm reduction, just having conversations about how they can reduce the harmful effects of their substance use. They're all a little bit different, but the crux of it is that it's a one-stop shop where people can come in and seek care for substance use, whether that's medication, withdrawal management, connection to services, or connection to counseling or harm reduction.
We are so pleased to have the expertise of Dr. Erin Knight and other addiction specialists who contribute to RAM clinics every day. Beyond the team-based mental health services, clinical health psychology collaborates extensively with other clinical programs, providing critical psychological treatment for medical patients. Their commitment extends further, traveling to multiple First Nations communities to address health and development needs for children. Finally, working alongside our partners in justice, our forensics and care supports and education teams provide critical assessment and treatment support for youth and adults involved in the justice system. Areas such as forensic mental health service saw increases in numbers of court-ordered assessments and criminal code review board reports compared to the previous fiscal year. Care supports and education team members supported a range of clinical services with consultation and education. And as we conclude this overview of our mental health and addictions portfolio, I acknowledge that there is a lot to absorb here. The service continues to be in a period of growth, evolving and integrating the programs of several previously existing organizations while working closely with all provincial partners. There are currently numerous projects and initiatives underway to bring more streamlined support to Manitobans needing help with their mental health or substance use, and we look forward to sharing more about these initiatives in the coming months. Thanks to Ben Fry, Chief Operating Officer, and the incredible team supporting mental health and addictions for keeping us all focused on how investing in good mental health is good for overall health. I would like to close out this section by acknowledging that this week has been proclaimed Manitoba Substance Use Awareness Week by Bernadette Smith, our Minister of Housing, Addictions and Homelessness, and Minister responsible for mental health. Almost everyone has either known someone or perhaps personally experienced mental health or addiction challenges. Sometimes trying to find the best way to show care and concern can feel overwhelming at times. Before we close out our discussion on mental health and addictions, I would like to show a brief video on how you can help show care and concern for someone who is struggling.
One of the things that I would encourage if you're worried about somebody's substance use is just to approach them with compassion and with genuine interest in what is driving their use of substances. All people who are impacted by substance use are primarily people. They have various reasons for why they're using those substances. And not all people who use substances have substance use disorders. It's important to just approach people with interest and with compassion.
Provincial Coordinated Health Services brings together a wide range of provincial programs and includes over 100 accredited language interpreters to support patients whose primary language is not English. This new department is continuing to evolve under the leadership of Monica Warren, Chief Operating Officer and Shared Health's Chief Nursing Officer. We are very proud of the work of Nicole Sneed, Executive Director, Health Services, Alyssa Lafort, Director of Health Services, and Chelsea Bremner, Program Manager, for establishing the provincial float pool to address staffing challenges across Manitoba. This program offers nurses an opportunity to work in another community or facility or specialty area on a casual basis to enhance their skills and expand their scope of practice. So a big congratulations to Nicole, Alyssa, and Chelsea and the team for your creative contributions to addressing staffing challenges, especially in rural and northern areas. We are also very grateful for the collaboration, innovation, and ideas brought to the table by the Manitoba Nurses Union, who has also been supportive of this initiative. Shared Health Administrative Services houses several core system support services, including finance, capital planning and facilities management, supply chain, digital shared services, clinical engineering, legal, and business services. These groups of staff are responsible for providing support to regional health authorities as part of a provincial approach towards coordinated and consistent provincial business services. As mentioned, these shared services exist to help regional health authorities focus on what matters most, the delivery of patient care in their communities. Our health system is connected by a digital web of interconnecting programs and applications managed through digital shared services. And it's worth to note that close to 166,000 virtual and telehealth clinical appointments were made possible by our provincial technology. Supporting regional health authorities and Cancer Care Manitoba, the digital team responded to nearly 339,000 services and support requests from staff and helped to keep our network safe by blocking more than 3.7 million threats. Thank you to Shared Health administrative teams for your work in keeping the wheels turning in healthcare. The health workforce team continues its momentum this year and is making some incredible progress. The team is led by Connie Newman, Provincial Lead Health Workforce. Significant work took place to negotiate the collective agreements with several sectors during our reporting timeframe. Through their efforts to streamline the health sector collective bargaining process and structure, they reduced the number of bargaining units from 200 down to 36, which is quite a feat. And the completion and implementation of these new collective agreements brings stability, incentives, and benefits to the entire workforce. Our recruitment teams have been busy recruiting a wide range of candidates into our workforce and working closely with communications on large-scale recruitment efforts and campaigns. This work includes our communications team to tell the heartwarming stories of employees working in Manitoba in a campaign called Manitoba is Hiring. The stories are uplifting and give voice to the pride that our teams take in their work, the love they have for their community, and the small things that make Manitoba such an incredible place. Let's see some of our communications team recruitment campaign work in action.
I walk out the door and I walk a few blocks and I'm already at my place of work, which is really great. I've always wanted to be a paramedic. Being able to help people really at their worst times. You'll notify when on route. I like being that person. We need to be able to provide the care and those interventions for our patient until we get to the receiving facility. Even though we're in a small town, they have gymnastics, they have dance, there's ball, there's hockey. You can go 20 minutes any direction and you're gonna be camping or at a nice lake. It's big, it's open, it's beautiful. My dream for my kids was to have a similar childhood as I did. And living rurally, my kids have that ability.
Manitoba is hiring. See how far your care can go.
Attracting new healthcare workers is a multi-pronged effort involving recruitment to education programs, efforts to retain new grads here in Manitoba, initiatives to improve retention, and efforts to bring specialized staff and physicians here from elsewhere. In 2023, these efforts took members of our nursing and HR teams from across the province to the Philippines to recruit trained and experienced healthcare workers to move to Manitoba. This initiative was based on the existing relationship between our province and the Philippines, the incredible Filipino community that exists in Manitoba, and past successful recruits, which occurred in 2008 and 2009. In recent weeks, I have had the pleasure of welcoming some of these staff and their families at the airport upon their arrival to Manitoba. They have been tired from their travels, but also incredibly excited to begin their new life here in Manitoba. There were hugs and tears and a genuine Manitoba welcome, and I do know that they will receive similar greetings as they continue to arrive and begin work in facilities across the province. So, and here is a glimpse of that Manitoba welcome for the first person who arrived, first family in Winnipeg.
What a heartwarming video. We wish all the new families much happiness and fulfillment as they begin their new lives in Manitoba and new careers in our health system. We wanted to take this opportunity to share a critical effort involving all regions and all employers within Manitoba's healthcare system. That is, provincial work to dismantle and disrupt racism in healthcare. Charlene Lafreniere, Provincial Lead Indigenous Health, and Connie Newman, Provincial Lead Health Workforce, co-chairs of the Disrupting Racism Initiative, are here today to give you a brief update on the activities of the initiatives and what we can expect in the coming months. Charlene, over to you.
Thank you, Brenna, and good morning or good day, everyone. I'm here to share about disrupting racism in healthcare. And we know that in order to disrupt racism, we must be deliberate as a system and as individuals. This work involves learning, taking action, and speaking up against instances of racism in any form, as well as supporting the systemic and structural changes that are needed to disrupt and eliminate racism. Disrupting racism begins with the acknowledgement of the wrongs and the resulting harms and the recognition that our history is rooted in the stories of people facing exclusion and discrimination based on their race. We are grateful that the Health Senior Leadership Council has publicly acknowledged racism and the work that we all need to do, whether we are in a clinical or an administrative environment. Manitoba's Disrupting Racism Steering Committee has been created to support the development, implementation, and evaluation of policies and strategies intended to progress Manitoba's health system towards dismantling systemic racism. And during this reporting period of Manitoba's Manitoba's health leaders declared that commitment. Now, I'm also really honored to share the progress in the critical work of creating safer healthcare environments for patients, families, staff, physicians, volunteers, and learners, and improving health outcomes for Indigenous, Black, and racialized patients. We're actively working to challenge and disrupt the organizational structures that perpetuate racism. Our strategy includes developing an anti-racism policy and lens to review current policies systemically. Through open conversations, workshops, and training sessions, we are aiming to foster a culture of equity and inclusivity. We are working at establishing safer reporting and support systems to address incidents of racism promptly. We're identifying and working towards key performance indicators to measure and monitor racism within our healthcare environment, ensuring continuous progress. We are mandating and enhancing anti-racism training, relying on Canadian reports and recommendations to develop this strategy. We need to build and support a diverse workforce. We're committed to hiring, retaining, and supporting a team that reflects the province's diversity. Key committees like the Disrupting Racism Committee, Communications and Engagement, a staff racial climate survey working group, and a policy working group are working together to address these issues. And there are folks from across the province on these committees. Along with the items listed on the screen, our notable progress and key achievements include the approval of our action plan and a budget by Health Senior Leadership Council, and the implementation of a provincial health system staff racial climate survey and its supporting reports and recommendations. I would now like to turn things over to Connie to further discuss the staff racial climate survey and the plan. Over to you, Connie.
Thank you, Charlene. As of March of 2023, we successfully completed a comprehensive racial climate survey, gathering valuable insights and perspectives from staff all across the healthcare system. This survey was a crucial step in our ongoing commitment to learn, listen, and understand the lived experiences of our team members. Following the survey, we analyzed the data through our partnership with the Centre for Health Innovation, identified key themes, and extracted meaningful comments provided by our staff. This invaluable feedback has served as the foundation for the development of recommendations that are not only informed by data, but grounded in the real experience of those working within our healthcare community. I would like to thank all members of the Racial Climate Survey Working Group for their contributions in launching this survey and preparing the data. Now our focus has shifted to the active phase of our journey, the implementation of these recommendations. Our provincial steering committee is currently working hard in crafting an implementation plan that addresses the specific needs and concerns raised by our staff. The commitment to implementing these recommendations is not just a checkbox on our to-do list. It's a pledge to our staff, patients, clients, residents, and our communities. Our efforts will be bold, and at times they will feel uncomfortable, as together we begin the necessary work that will continue for generations. We commit to listening and learning, and to calling out instances of racism and discrimination, whether subtle or overt, passive or aggressive. Join us as we take informed steps to adapt our words, our actions, and our systems. Together, we will create culturally safe, inclusive, and equitable health experiences and working environments. Thank you.
Thank you, Charlene and Connie, for leading this very important work. I wish to commend the Provincial Steering Committee and subcommittees for tackling an issue as deep and heavy as racism, and for championing the importance of addressing this head-on. It is clear that the results of the provincial survey, available online, validate that healthcare staff carry the burden and harms of racism in their daily lives while at work, and we must do what we can to create safe and secure working environments for all. I would also like to thank the communications team for bringing this topic to life in a respectful visual way to help with our learning and understanding. If you have a moment in your spare time, I would encourage you to access the digital version of this year's annual report to the Minister and report to the community for a more comprehensive look at our accomplishments. Learn more about our commitment to equity, diversity, and inclusion, and how we are standing as allies with our colleagues and other members of the 2SL LGBTQIA+ communities, as well as about our strategic plan for Francophone health. Read more about our strategic communications and stakeholder relations department led by Olivia Baldwin, provincial lead, is supporting the internal and external work of shared health clinical and operational departments and key campaigns such as Kid Care, Manitoba's Hiring, Disrupting Racism, and countless recognition events that celebrate the incredible contributions of physicians and staff. And lastly, take a look at how the Health Services Integration and Clinical Planning team continued to evolve throughout the reporting year and supported various models of care and optimizing of services. While it's impossible to share all the remarkable work in this presentation, our annual reports are a great reflection on what our teams have been up to in service of healthcare. Next up on the agenda, Dale Gustafson, Chief Financial Officer, will provide us with a brief overview of our financial position for the year 2022 to 2023. Dale, over to you.
Well, good morning. Thank you, Brenna. To everyone, I'm Dale Gustafson, the Chief Financial Officer. I do have the pleasure of quickly presenting our 22-23 financial results. A couple things. First, I want to extend a very deep gratitude and my thanks to every individual who contributes to this work. And I'm proud to say that after our audit activities, we do have an unmodified audit opinion. And for those of you seeking a comprehensive view, the complete audited financial statements package, all 35 pages, are available on our intranet website. The past year has been marked by a series of transformative changes, and our operations landscape has evolved significantly. We have introduced elements to Shared Health that will make a traditional year-over-year comparison challenging. Looking at our statement of financial position, the budget balance sheet, you're going to see a substantial increase in the liability section under long-term debt and intangible capital assets under non-financial assets. On July 1st of 2022, as part of the Health System Transformation Plan, Shared Health incorporated the tangible capital assets and the associated liabilities from various entities, including Health Sciences Centre, the Manitoba Adolescent Treatment Centre, Addictions Foundation of Manitoba, the Chatham Provincial Laboratory, and Selkirk Mental Health Centre. And additionally, we did digital information and communication technology assets for a significant portion of the province, all being integrated into our operations. That's why you see the changes in both assets and liabilities. The next noteworthy point pertains to adopting a new public sector accounting standard for asset retirement obligations effective April 1st, 2022. This standard involves the assessment of present day values of future cash that we will need to fulfill obligations related to legislative activities such as asbestos remediation and the disposal of substantial equipment containing hazardous materials. There's a new entry under liabilities on the statement of financial positions. The majority of our accounts receivable is attributed to Manitoba Health, and payables, the notable increase can be largely attributed just to the expansion of Shared Health. The vacation, overtime, pre-retirement leave, and sick leave increases are due to many employees transferring into Shared Health. As we look at our summary statement of operations and accumulated surplus, which is essentially the income statement, there are a few items to point out as well. But before we get into that, I want to recognize our supply chain team that has worked extremely hard with our vendors to mitigate impacts and the influence of inflation on our supply and drug costs. You will see the year-over-year increases in revenue and expenses explained by several events. On April 1st, 2022, the services and operations of Addictions Foundation of Manitoba, the Caddo Provincial Lab, and Selkirk Mental Health Center transferred to Shared Health. And in August of 2022, as noted, the collective agreements with CUPE and MGEU were ratified. And there was a one-time impact on our financials as we settled wages for prior years. The diagnostic services expense line was reduced because of a shift from COVID-19 testing relative to the mass testings we were doing in 2021 and 21-22. And this year, our non-insured services, mostly comprising of our commercial and parking operations at Health Sciences Center, have returned to surplus. As mentioned, the impact of the tangible capital assets and related liabilities coming into Shared Health, for example, Health Sciences Center and Digital ICT, shows a net of a $389 million restructuring gain. That is a non-cash accounting entry. And lastly, I do want to point out and provide some context to the 7.77% administration cost ratio, which people will notice appears to be higher than in 21-22. And there are a couple things influencing that. First of all, the first thing is the $389 million restructuring gain from the transactions I just spoke of is included in our administrative cost ratio accounting. So it's reducing Shared Health's overall expenditures from 1.9 billion to 1.5 billion in that calculation. The denominator is going down. And second, the Transformation Management Office costs, or TMO, not under Shared Health's influence, are included in our administrative costs. Thus, the numerator is higher. When we exclude both TMO and the restructuring gain, the true administrative costs for Shared Health are 4.7% of all of our expenditures, and that aligns us much more closely with national health organizations and the 21-22 Canadian average of 4.3. So I want to thank you all for what I'm sure was full attention. I know that the finance is always the most highlighted and celebrated component of an annual general meeting. So I will hand things back off to Brenna.
Thank you, Dale. And thank you to the finance team for your work and transparency. Your work is much appreciated. As we reflect on the positive aspects of the 2022-2023 year and celebrate our achievements together, it's equally important to acknowledge the truths and challenges our healthcare community and staff have faced and continues to face. Recruitment, burnout, feeling valued, experiences with racism and discrimination, and wait times. We want to be transparent about these, and we can only move forward and make necessary changes when the truth is in front of us.
We have renewed hope with the opportunity to address pressing issues that exist in healthcare. The focused attention that our new government is bringing for opportunities to collaborate, innovate, and pursue initiatives that will improve the working conditions of our teams and the important care and services that they support for Manitobans. As Shared Health continues to develop its 5-year strategic plan, we are aligning our goals with the priority areas of population need and the mandate commitments of a new government. Our vision, mission, values, and purpose reflect the attitudes, behaviors, and beliefs that our patients, our staff, and the public expect of us. Together, in collaboration with the experts who support the delivery of care each and every day, the health regions that plan and support services across the province, and our partners who fund and invest in priority initiatives, we can achieve meaningful and sustainable improvements across our healthcare system. This has also been a significant shift in our own organizational leadership since I have joined Shared Health. I do believe this change will bring new perspectives and energy, positioning us to move forward with confidence and purpose and attuned to the truths that you have told us. Our new senior leadership team, shown on the screen, is fully committed to delivering on our health human resource strategy and taking care of you, our patients, our staff, and our partners. Our focus remains on recruitment and retention, improved access and wait times, and better supported staff wellness, including efforts to ensure our teams have the tools they need to provide exceptional patient care. We will get there by listening and learning and being fiscally responsible and caring about the people we serve.
Building and strengthening all areas of our health workforce now and into the future in urban, rural, and northern communities. Supporting our current workforce to provide the best care possible. And using innovative technology to enable information sharing and more access to care across the province.
Building more opportunities for timely, equitable access to appropriate care closer to home. Collaborating with our educational partners to build education and training capacity. Focusing on workplace culture, staff wellness, and staff safety, and committing to continuing our work on disrupting racism and working towards truth and reconciliation. In closing, merci, Megwich, and thank you for joining us today. Thank you also so much to Minister Asaguera for making the time to be here. We are most appreciative of your presence. And so now we can head into our Q&A, and I will pass the mic over to Chad.
Great, thank you very much, Lynette and Brenna. I would also ask our other panelists to join us on screen while we're starting the question section. Just as a reminder, we ask that you please enter your questions into the question section on the GoToWebinar panel. We would note that your questions will not be shown on the screen, and so you do not have to worry about that. So at this time, I would invite any questions. So we have some that have started to come in, so thank you very much for the engagement. We appreciate that a lot. Initial question we have here, we've heard a lot about staffing needs across the province. What work is underway to encourage people to work in the health system? Lynette, I would ask maybe you to touch on that, and also Connie. Sure,
I can get started. So yeah, staffing is definitely our top priority coming out of the turbulent time of the pandemic. And so the things that we have been looking at, it's definitely a multi-pronged approach. There's not one easy solution or even one difficult solution. It's multiple solutions. So first and foremost, I would say we need to listen to our staff and hear what they're saying about how things could be better, what they need, and make sure that we have those supports, whether that be administrative burden, whether that be more support staff, whether that be different ratios. There's lots we can look at. To date, we have been looking at innovative models of how we can support nurses, whether that be in the float pool, where they have a bit more flexibility and choice, or potentially the unis that were introduced previously, where we have student nurses coming in and learning and being mentored in the system and preparing them for a successful launch into the nursing profession. So there's those things. There's also just the recruitment and retention, as discussed. We've been working locally, nationally, internationally to recruit healthcare workers and into Manitoba, so that work will continue. And yeah, I think those are some of the things that come to mind, but also just that focus on when not just recruiting, but also retaining, so that when you're in our system, that you have balance, you have the ability, the need to stay and take care of patients, and that we make work life better for you. So maybe I'll pass it over to Connie as well.
Thank you very much. Just a couple of points I will add. As we think about recruitment, because it is definitely very important to us right now, we do have a strong complement of staff dedicated to recruiting specialized and high demand staff into the system. for a variety of types of positions and for sites across Manitoba. And the other thing I'll mention is that we are committed to our partnerships with the educational institutions to grow our healthcare workforce and offer clinical placement opportunities and continue to foster relationships to help trained healthcare staff here in Manitoba with that piece. And the only thing I will mention too is that I believe it was Brenna that talked about wellness, that's really important in changing our culture as well with that will help us to hopefully recruit and retain and keep our employees in Manitoba. Thank you.
Terrific. Thank you both for answering that question. Appreciate it. And I just wanted to know too, we had asked earlier for for individuals to pop in and let us know where they were watching from. We did have a couple mention. Hello from Toulon, and then also good morning watching from Flin Flon through the up in the Northern Regional Health. So thank you very much to both of you for joining us today. And so we did have a couple extra questions come in, and so we'll get to those. Paula was wondering, what is the difference between the minor injury treatment clinic and an urgent care clinic? Monica, could we ask maybe that you touch on that one?
Sure. The minor treatment clinic really looks at, it's almost like a walk-in clinic for people who are having trouble accessing what would be that in their community. So they would be a lower acuity patient, may need a dressing change or a medication. And so it's an accessible option for that core area of Winnipeg that may have trouble getting to a primary care provider. We see that kind of patient population coming into our urgent care facilities. Sometimes it may be an urgent need when the primary care provider is not available. So very similar clinical needs coming into both areas. But of course, urgent care has a much broader complement of services beyond just a minor treatment issue.
Great, thank you very much for that, Monica. And I would just note that Monica is our COO of the Provincial Coordinated Health Services team. So we had another question come in. Are the report to the minister and the report to the community different? If so, where can we find the report to the community? I would just not sure if Lynette, if you want to touch on that. And I would note also that the reports will be placed online on our Shared Health website.
Yeah, that's exactly what I was going to say, Chad. We'll make sure that the information is available on the website for anyone to access as available.
Perfect. Thank you for that. We had a question regarding benefits. Tracy asked, I was wondering if Shared Health will work on improving our health benefits, such as prescription benefits, so that we are competitive with other provinces. Connie, I would ask if you could maybe touch on that.
Sure. I think you're speaking about the extended health benefits program that is available for our employees. And yes, I think there is an opportunity. We are in the process of reviewing the benefits and what's contained within there. It's a bit of a process. We understand the need to be competitive, and we also understand the need that benefits should be supportive to our employees. So we are looking what's contained within and where there are opportunities to enhance and expand. So it's currently under review.
Terrific, thank you for that. So we had a question come in from Catherine. Catherine noted that rural northern Manitoba is very different to the south. Some decisions made in the south do not work in the north. And so Catherine asked if a northern tour would be considered by the executive leadership team.
Absolutely. We prior to COVID, we were traveling up to the north, and but with our newer leadership team, I think that's the best way to build relationships and to learn about each other in terms of the challenges and also the great work that is happening. So yes, we all will be visiting Northern in due time.
Great, thank you, Lynette.
And rural too, I'll say, rural as well.
Right, terrific. So we had another question. The last few years have been really tough for healthcare workers, and we hear several stories about nurses and others retiring or leaving their jobs. What steps are being taken to keep the staff that we have?
Do you want to speak to that, either Monica or Connie?
I think there are a number of initiatives that we currently have underway to retention. With regards to some initiatives that we've spoken about, such as the provincial nursing flow pool that provides some flexibility, different type of flexibility for the nurses. We also have announced, there was an incentive that it was announced last year regarding retention to try and retain some of the staff into their positions. And at the same time, we're also looking at working conditions. So when we talked about the wellness initiative and that being one of our priorities, that really is about looking at work-life balances and different balanced work schedules and different supports that would be in place for employees so that that they can improve their working conditions within their work life. And so we have a number of those initiatives underway, with wellness being one of our priorities. And wellness doesn't only mean benefits; it is supports that could be accessed by our employees, but it's also about creating that positive and safe work environments and workplace that prioritizes staff well-being. I don't know if you had anything to add, Monica?
I was just going to add that nurses that are towards end of career are so valuable, and really need to hear from them in terms of what they think would help keep them here. So my door is open. If they want to reach out to me, I'd love to hear your ideas or suggestions because we need you too more than ever. So thanks for asking the question.
Great, thank you both very much for answering that. So at this time, we're going to close the question and answer session, which will conclude our 2022-2023 annual general meeting. If you do have any further questions, please feel free to email us at info@sharedhealthmb.ca. If we have not responded to your question today, we will post answers to those questions in the section of our website where you can find the annual report as noted on the screen. Thank you very much to everybody, and we hope you have a wonderful rest of the day.